I want to jump to some of the newer treatment radiation,
Yes.
SRT. What does
Yeah.
SRT mean?
Well, we're really excited to be the practice in Knoxville that has this, and we predict there'll be more, but we got it first. So, so SRT is made by a company called Census, and this has been around for a while. In fact, historically speaking, for those of you who have not heard of radiation treatment for being used for skin cancer, actually the first cancers ever treated with radiation were skin cancers, which makes perfect sense when you think that back when radiation was developed, we didn't have MRIs.
Yeah.
You couldn't do an internal tumor because you couldn't tell if you got rid of it or not. You could watch a skin cancer dissolve, right? So that was used for quite a while until surgical technique got so good and you could get good margin control. You could tell if it was all out, and that seemed to kind of blow by the radiation techniques.
So how do you do the radiation?
Well, the more new technique is to use a very nice piece of equipment that's got a lot of fail safes, very, very safe piece of equipment for SRT, which is superficial radiation treatment. So it goes about 4 millimeters into the skin.
So 4 millimeters is a little less than a razor.
Yes, it's not very deep, but it's deep enough to get most basal cells and squamous cells, okay? And, it's less radiation than a dental x-ray per treatment, okay? So we're not talking about, big time radiation. So if somebody's had radiation for, prostate cancer or breast cancer, and they think, oh gosh, I don't want to, that was a lot. People don't even notice. It's very easy to do.
How do you guide the radiation? How do you determine how wide an area that you're going to radiate?
Yes, well, it depends upon the type of cancer. So if it's a basal cell carcinoma, typically you've got about a ½ centimeter margin around here. We usually use about 1 centimeter for a squamous cell carcinoma, and they build the little lead shields that protect the rest of the skin and protect the rest of the person from any radiation, which is not going to happen. But the biggest advantage of this is it is pain-free. Okay, so certainly in a day where we're worried about opioid pain relievers, etc., you don't have to worry about your skin cancer requiring a lot of pain medication to remove, or a lot of discomfort, needles, etc.
So it sounds to me like this is new, innovative, exciting, effective. Does it leave scars?
Much better. Of course, you'll probably have the biopsy scar, okay? But with that, really, I've seen pictures where there basically is no scar, okay? So, still, I think surgery can be a wonderful thing. So surgery and Mohs surgery are still gold standard treatments, but even the finest surgeon has a hard time removing something from a nasal tip without some form of scar. This can do better, okay? So minimal scarring. Another beautiful thing is no bleeding, and we have so many patients who are on blood thinners these days that can't really get off of those very easily without it being a health risk, yet they also don't want to experience post-surgical bleeding. So there's that advantage, which is a big one. Another advantage is, gosh, we have so many golfers who get skin cancer. And when I take a skin cancer off their wrist and tell them that they're off the course for a month, they're not happy. So you can do SRT for a skin cancer right here and keep your tea time. So
there are lots and lots of benefits.
Lots of advantages. So yeah, so some better scarring, don't have to worry about the infection risk. Lower too, we didn't mention that, okay? And these days surgically, I feel like I'm sending my patients out into staph world out there, because the infection rate, none of us want to admit it, but has climbed, and it's just because of so many bad bacteria out there and how common they are. And so certainly there are a lot of people who don't want to have to take an antibiotic. Well, if you don't get an infection, you don't have to take an antibiotic.